What if the problem isn't your desire, not your testosterone, not even your blood flow, but a set of muscles you haven't deliberately used in years? Tonight, I'm going to show you a 60-second routine you can do in bed with something you already own. It's simple, it's surprisingly intense, and it can help your body remember how to recruit the pelvic floor during arousal. But I'm also going to be very honest with you. This isn't magic. It won't fix every cause of erectile dysfunction, and if you do it wrong, you'll waste your time. So stay with me, because near the end, I'll show you how to tell if you're actually training the right muscles, how to avoid the biggest mistakes, and what to do if your erections still aren't improving after a few weeks. Let's turn a normal pillow into a signal, a cue that teaches your body to switch on what matters. This video is educational, not personal medical advice. Erectile dysfunction can be linked to heart and blood vessel health, medication side effects, diabetes, low testosterone, depression, sleep apnea, and more. If you have chest pain, severe shortness of breath, a history of heart disease, or you're using nitrate medications, talk to a clinician before trying anything for ED. Also, pain is not a good sign. If you feel sharp pain, stop. Now let's talk about what's actually going on. When men think about erections, they think about blood flow, and they're not wrong. Erections are largely vascular. But erections are also mechanical. Think of it like filling a tire with air. Blood inflow is the pump. The valves and surrounding structures help trap that pressure. And the pelvic floor muscles can contribute to rigidity, especially in the staying firm part. There are two muscles you'll hear about often in anatomy discussions, the ischiocavernosus and bulbocavernosus/bulbospongiosis. Research reviews and physiology texts discuss how the ischiocavernosus is involved in the rigid erection phase and how these muscles interact with penile structures and venous outflow. Now, there's also nuance here. Some sources note erections can occur without obvious contraction activity, but voluntary contraction may help some men boost or maintain firmness. That's the key point. For many men, it's not about creating an erection out of thin air. It's about supporting it, like stabilizers. And here's why age matters. After 60, many men are less active, sit more, have had prostate or bladder issues, back pain, hip tightness, or years of stress. That combination can lead to pelvic floor muscles that are either underactive, weak, not responsive, or overactive, tight, guarded, fatigued, or a weird mix, tight and weak. So the goal of today's routine is not crush your way to masculinity. The goal is restore control, strength plus relaxation, so the muscles can do their job at the right time. Now we get into the pillow. Your inner thighs, your hip adductors, attach around the pelvis and interact with pelvic mechanics. In many rehab settings, clinicians use neighbor muscles as cues to help you find a muscle group you can't see. The pelvic floor is famous for being difficult to locate. Even research on teaching men pelvic floor contraction shows that specific cues often work better than vague, squeeze your pelvic floor instructions. So the inner thigh squeeze can function like a practical cue, something you can feel immediately, so you stop guessing. But I want to be responsible here. The idea that hip adduction automatically strengthens pelvic floor function is not universally proven. Evidence in some populations is mixed, and at least one study in healthy women found hip adduction didn't clearly justify better pelvic floor strength outcomes in training. So what's the honest framing? Use the pillow squeeze as a signal to recruit and coordinate, not as a miracle replacement for comprehensive pelvic floor training or medical evaluation. It's a tool, a starter, a way to feel the right area. And if you do it with the right rhythm, it can be a powerful daily practice. All right, here's the routine. Setup, 10 seconds. Lie on your back. Bed or floor is fine. Bend your knees comfortably, feet flat. Put a standard pillow between your knees. Now the key, position and effort. Your hips and knees shouldn't be jammed together like you're folding yourself into a pretzel. You want a natural bend. If you feel hip pinching or back pain, adjust your distance. The contraction, 3 seconds. Squeeze the pillow with your knees or inner thighs hard, like you're trying to compress it. While you squeeze, do not hold your breath. Think. Exhale gently as you squeeze. The release, 2 seconds. Fully let go. Don't half relax. Reset completely. Repeat that cycle for 12 rounds. That's 3 seconds squeeze plus 2 seconds release equals 5 seconds. 12 cycles equals 60 seconds. That's it. But to make it work, you need to know what you should feel. What you should feel. Inner thighs working. Yes, a burn is normal. A subtle lift or tightening sensation deep in the pelvis. Improved awareness. You can tell when you're squeezing and when you're relaxing. What you should not feel. Sharp pain in groin, hips, knees, or low back. Cramping in the front of the hips. A breath-holding strain like you're deadlifting. A massive glute squeeze that takes over everything. Here's a big mistake many men make. They squeeze the pillow, and their butt does all the work. Or their abs brace like they're preparing to be punched. That's not the goal. This is control training. A clean squeeze and a clean release. If you're not sure you're doing it right, here are 2 cues that can help you find the pelvic floor more directly, used in pelvic floor instruction research. Imagine shortening the penis slightly, or think lift the base gently without clenching your entire body. Again, gentle cues, not panic clenching. A lot of men hear an exercise and immediately turn it into a toughness contest. More reps, longer holds, no rest. But your pelvic floor is not a bicep curl. In function, these muscles need to do 2 things well. Contract at the right moment, relax fully right after. If you skip the release, you train tension, not performance. Also, the squeeze-release pattern helps your nervous system learn coordination. In simple terms, here's the signal, here's the contraction, here's the reset. Now repeat. That's motor learning. That's how people regain control after years of offline muscles. Now, let's talk results without lying to you. Pelvic floor training has been studied for erectile dysfunction. A systematic review found many studies reported improvements, but also noted differences in methods and quality that limit certainty. Translation: there's promise, but not a guaranteed outcome for everyone. So here's what I consider realistic. In the first week, better awareness. You can feel what you're doing. Some men notice improved morning firmness. Others notice nothing yet. This is normal. In weeks 2 to 4, improved control. You can switch on the pelvic floor more deliberately. Some men report easier initial hardness and better staying power, especially if the main issue is mild to moderate function and coordination. But here's the honest truth nobody wants to say. If your ED is mostly vascular, driven by diabetes, severe atherosclerosis, uncontrolled blood pressure, heavy smoking history, or medication effects, this routine alone might not be enough. It can still help. It can still improve confidence and control, but it won't replace medical care or lifestyle changes. So I'm going to give you a framework to know whether you're the right match for this exercise. This routine tends to be most useful if you relate to any of these. You can get an erection sometimes, but you lose it quickly. You notice erections are weaker when you're tired or stressed. You've never trained pelvic floor control in your life. You have mild urinary dribbling or weaker stop-start control, often linked to pelvic floor function. Your morning erections used to be consistent, and now they're on and off. This is less likely to be a solo solution if you almost never get an erection, even alone. You have numbness, severe pain, or major circulation disease. You're on medications known to affect erections and haven't discussed alternatives with a clinician. You have symptoms of low testosterone and haven't been evaluated. But even in those situations, training coordination is still a good piece of the puzzle, just not the whole puzzle. Let's make this practical. I want you to do the pillow signal routine for 10 nights in a row, 1 minute before bed. Not 20 minutes, not a new identity, 1 minute. Here's what you focus on. Days 1 through 3, technique, strong squeeze, clean release, normal breathing, no pain. Days 4 through 7, awareness. Are you feeling that deep pelvic engagement more clearly? Are you less guessy when you try to contract? Days 8 through 10, check-in. Any change in morning firmness? Any improvement in control during arousal? Even a small improvement matters because it tells you the pathway is waking up. If you notice improvement, you keep going for a full 4 weeks. If you notice nothing, you adjust because the issue might not be muscle recruitment, or you might be doing it incorrectly, or you might need a different approach. Which brings us to the most common mistakes. Mistake number 1, pillow too soft. If the pillow collapses with no resistance, your squeeze becomes meaningless. Use something with moderate firmness. Mistake number 2, gentle squeezing. This isn't a meditation squeeze. You want a hard, clear contraction without pain. Mistake number 3, breath holding. Breath holding turns this into a strain response. Keep breathing. Light exhale on effort. Mistake number 4, no full release. If you stay tense, you train tension. The release phase matters. Mistake number 5, expecting instant permanent change. Muscles and nerves adapt with repetition. Give it weeks, not minutes. Now I'll add a 6th mistake, my personal big one. Mistake number 6, believing pelvic floor training means you're broken. No, it means you're training a neglected system, like balance, posture, or grip strength. It's normal. It's smart. If you want to level up without turning it into a circus, do one of these. Upgrade, add a quality check rep. After your 12 cycles, do one final squeeze at about 70% intensity for 5 seconds. Then fully relax. This reinforces control and reduces cramping risk. Upgrade, add a daytime signal rep. Once a day, do one 3-second squeeze, no pillow needed, while standing, then fully relax. You're teaching your nervous system that this skill isn't only in bed. Upgrade C, pair it with basic blood flow habits. Because again, blood flow matters. Even light daily walking, better sleep consistency, and reducing heavy alcohol at night can make a difference. Pelvic floor coordination plus circulation support is a stronger combo than either alone. And yes, if you want to be serious, talk to your doctor about cardiovascular risk factors. ED can be an early warning sign in some men. Let me give you the clearest, most respectful truth I can. Erections are not a willpower test. They are a health signal plus a nervous system state. If you're anxious, rushed, ashamed, or trying to perform, your body can shift into stress physiology, which is the opposite of arousal physiology. So while you're training the muscles, also train the environment. Slow down, remove pressure, stop chasing a perfect outcome. Focus on sensation and connection rather than grading yourself. Sometimes the biggest improvement comes when the nervous system stops treating sex like a job interview. And if you're in a relationship, talk about it. Not in a dramatic way, in a teamwork way. because secrecy adds pressure, kills arousal. If you do this nightly for 3 to 4 weeks with good technique and you see no change, that's not failure. That's information. At that point, consider a medical check for blood pressure, glucose, A1C, lipids, testosterone if indicated, reviewing medications with your clinician, screening for sleep apnea if you snore heavily and wake unrefreshed, seeing a pelvic floor physical therapist. Many men benefit from guidance, especially if the pelvic floor is tight rather than weak. And if you ever have pain, numbness, or sudden changes, don't self-experiment. Get evaluated. Let's simplify everything you heard. The pillow squeeze is not a miracle. It's a signal that helps you recruit pelvic floor support. The goal is strong squeeze, full release, normal breathing. 1 minute nightly, at least 10 days, ideally 3 to 4 weeks. Combine it with better sleep and basic movement for best results. And if ED persists, treat it like the health signal it can be. Get real support. And here's the part I really want you to remember. Your body doesn't suddenly stop working after 60, but it does respond to what you train and what you ignore. So tonight, don't overthink it. Grab a pillow, do 1 minute, and let that be your first vote for better control. If you want, in the next video, I can show you a second routine that pairs perfectly with this one, something that improves pelvic blood flow and reduces pelvic tension, because strength without relaxation is only half the equation. Until then, 1 minute, 1 signal, and a calm nervous system. I'll see you in the next one.